This is Michael. He's just started college and is usually friendly and outgoing. But lately, he's not been feeling himself. When Michael leaves his room, he is convinced that strangers can hear his thoughts and are following him. He feels frightened. When Michael's alone, he is certain that he hears voices telling him that something bad is about to happen. Michael's paranoia is affecting every part of his life, and while his friend Jasmine knows something is wrong, she isn't sure what's happening or what to do. Michael is experiencing psychosis. For most people, it is a scary and confusing experience. It can also be upsetting for those, like Jasmine, who witness a psychotic episode and don't know what is happening or how to help. Understanding psychosis and being able to recognize signs of it is the first step to not being afraid of it. And it lets you reach out and offer help to someone who may be in need. Psychosis is treatable, so getting someone help is the goal. So let's take a closer look. What is psychosis? Psychosis is a set of symptoms that impacts a person's thoughts and behaviors. Psychosis symptoms are different for everyone, but the common experience is losing touch with reality. During a psychotic episode, sufferers can become confused and misinterpret what is going on around them. How long the symptoms last and how intense they are varies from person to person. Psychosis can affect people of all races, ethnicities, ages, genders, and cultures. What are the symptoms of psychosis? Hallucinations are sensory experiences that only exist in the mind. Even though Michael is convinced the voices he's hearing are real, they are actually auditory hallucinations. These are a common symptom of psychosis. Hallucinations might also be visual, which means seeing things that aren't there. People might also smell things and even feel things that no one else can. Another common symptom is delusions. Delusions are firmly held beliefs that seem very real to the person, though they are not real. People can suffer from many different types of delusions. In Michael's case, he has the delusion that people are listening to his thoughts with the intent to harm him. And even though his friend Jasmine tries to explain to him that it can't be real, Michael is certain. Some other delusions people might experience are believing they're superhuman or in touch with a divine force. When understanding whether a person has a delusion, it's important to consider that culture can influence how people express their feelings, thoughts, and emotions. What is an accepted belief in one culture might be considered unusual in another. Disorganized thoughts are another symptom of psychosis. Like Michael, people having a psychotic episode may make up or use words or phrases that don't make sense to anyone else. For Jasmine, Michael's behavior is becoming a little frightening. He seems confused, and sometimes Jasmine struggles to understand his muddled sentences. Even if they appear distressed, many people with psychosis may not be aware of or recognize their symptoms. Others may feel that their symptoms actually have a positive impact on their lives. But for most, psychosis is a distressing and confusing experience that could be a sign of a serious medical condition. What conditions are associated with psychosis? Symptoms of psychosis are associated with some serious mental illnesses. Schizophrenia typically flattens the emotional expression in people's speech, tone of voice, and body language. Schizophrenia always includes symptoms of psychosis. Bipolar disorder is characterized by unusual and extreme mood swings, which can shift rapidly from high to low and back again. At times, it can include symptoms of psychosis. Major depressive disorder causes persistent feelings of sadness, and it can sometimes include symptoms of psychosis, although it's uncommon. These are not common illnesses, but they are serious, and the first symptoms usually start very late in adolescence or early adulthood. Also, psychosis can sometimes be a side effect of drug and alcohol use or withdrawal. And psychosis can also be triggered by medical conditions, such as a stroke, traumatic brain injury, or brain tumor or cysts. What do you do if someone is experiencing psychosis? Jasmine is very worried about Michael. Though in the past she has tried to convince him that what he is experiencing is not real, she has noticed that that approach is not helpful. She knows now that the delusions and hallucinations are very real to him, so she has learned to be careful. She avoids appearing to dismiss them or even trying to talk him out of them. Instead, Jasmine decides to talk to him about getting help. People with psychosis may not reach out for help because they may not recognize that there is a problem or may worry about being judged. But if symptoms are left unaddressed, people can experience a significant loss of daily activities, poor health, and be a risk to themselves. Jasmine approaches Michael gently, in a caring and non-judgmental manner. She communicates with him in a calm, clear way and encourages him to talk to someone he feels comfortable with, such as his doctor, mental health professional, or someone he trusts. The road to recovery may be long and hard, and it takes work. But with appropriate interventions such as medication, talk therapy, and social supports, psychosis can often be managed, and people can be supported to live full lives. You can also find help by calling, texting, or visiting NYC Well online. And remember, caregivers need emotional support too, and NYC Well can be a resource. Get the help you need. Free, confidential, and available 24 hours a day, 7 days a week.